case you have any interest in knowing where we're at. So my job is to try to go out and meet nice folks like Jackie and Shannon and build our business. So I have Olivia here with me today as well. Olivia is one of our newer employees. Her job is a community care coordinator. So as we are orthotics and prosthetics. So she mainly deals with our prosthetic patients, trying to guide them through the process from before surgery, if they know about the surgery coming up until the point where they do receive a prosthesis, and helping them through that whole process. And the person that's going to be talking the most today is Cece. Cece is one of our orthotists and prosthetists. She's primarily orthotist and prosthetist, certified orthotist prosthetist.
CPO is easier.
Yeah,
so you can
now you know what it means when somebody says CPO. See, you learned something today.
She'll remember it.
No,
She is out of our South Side office and primarily out of our Monroeville office as well, but we drag her around as often as we can to other locations when she's willing. She does a lot of work with our pediatric population as well, so we do deal.
a lot of children have to wear that.
Not these, but other products that we have. I noticed when I came in there was a lady that had an ankle foot orthotic on. Things like, So things like that, sometimes kids need early on to help with their gait training and things like that. So Cece does a lot of work with the pediatrics. So this particular brace is more for arthritis, so we don't have things like that for kids, but we do have a lot of other things to try to help them out early in life so they'll grow up and be able to walk normal and get around normal and not have any issues. So I'm gonna turn this over to Cece. She can talk a little bit more about the brace. I have some handouts to share with you, and then we're gonna pass this brace around. And it's a small group, so interrupt at any time. Any questions you have, please ask.
All right. So again, my name is Cece. I work primarily in the Monroeville office. We actually are the #2 clinic in the whole country that makes these braces. So I probably do about just anywhere from 3 to 5 of these a week in the office. So they're a very popular brace, especially amongst the Pittsburgh region. So let's talk about it. So what's different about the Evoke brace versus other braces that you might get, particularly for arthritis or any knee injuries, MCL tears, ACL tears, things like that, is it's a 3D printed brace and it is custom. So what we mean by custom is we either take a cast impression of your leg or we scan it using our TechMed scanner that has about 0.2 millimeters of accuracy, so it's a very accurate scan. And we send it out to the fabrication lab out in Canada called Oskins, and we are able to tell them how many degrees of offloading we want on the knee. So when you hear the word offloading, what I'm talking about is where that area of arthritis you're having is. So most people either have medial or lateral arthritis. Medial is probably the more common one. And when you're talking about that, we're talking about bone on bone. You'll hear that term a lot. So if you have medial arthritis, you're bone on the inside. If you have lateral arthritis, you're bone on the outside of your knee. So what the brace is doing is a 3-point pressure system, and it's actively offloading that area of arthritis on your knee. So it's pushing off and causing a more neutral alignment for your knee and working against gravity. So it's not a cure to arthritis. The only cure to arthritis is a knee replacement. But it helps stop the progression of the arthritis. So it's a very good alternative rather than having to get surgery. Of course, there are times that surgery is the only option, but this is a good step to try before going to surgery. What makes it different versus other braces, not only is it custom, but it is very low profile compared to a lot of braces because it is 3D printed, and it's very lightweight. So I'm going to pass it around for you guys so you can feel how light it actually is.
Oh, wow.
Yeah, so it's made, the 3D printing material is a polygrade, air grade 3D printing material. So it's something that they use in airplanes. That's outside my scope of practice in regards to things, but it's very lightweight, but it's also very strong. And what's nice about the brace itself too, the company, anything that's hardware, So anything on the hinges, the frame itself has a lifetime warranty to them, so if something breaks, the company will replace it, so that's also pretty great. And it helps keep the traction of your knee the same rate when it's bending and flexing your knee, rather than other standard braces where you just take measurements and it's kind of an off-the-shelf thing. Because you have it set up to your knee alignment, it matches the tracking of your knee. So it's actually the opposite knee too, just kind of give you an idea. It's pretty close fit for you.
Yeah, that is
Yeah. Yeah, so it's nice, you know, especially for patients that have bilateral knee problems. You definitely lose the kind of bumping into each other a little bit less. I mean, that still happens just because you have knee braces on, but because it's a lower profile, it happens less often. And also because it's fit for your leg, it's custom, the amount of, you know, a knee brace dropping down on you decreases dramatically. I think that's the biggest complaint amongst patients when it comes to knee braces is that one, the bulkiness, and two, falling down.
Nice grippers.
Yes, yeah, they have a nice like silicone on there. Yeah, so it's a really great brace. I put my aunt has knee problems, and I put her in that knee brace, and she said it's been like super helpful for her in the past year or so. I trusted enough to put my own family members in it. I see the results, and it's not just for arthritis, ACL tears, MCL tears, any knee injuries. It's a good knee brace to have for.
My brother tore his MCL and he chose not to have surgery, so he does wear a brace.
Okay.
Just one of the slip-on ones.
Yeah.
Like for when he golfs or whatever.
Yeah, just a little bit of stability. And there is times where you might just need something a little bit less intense as like that knee braces, but as far as like if you have to be wearing something like a lifetime thing, a 3D printed custom knee brace might be a better option for somebody if they decide not to have surgery, but they're going to need the extra support. And the thing I would say about any bracing like for your knees or things like that, always looking at it as a tool in your toolbox.
Can you exercise with them on?
Absolutely, yep. Yep, you can wear it to the gym, you can walk with it on the treadmill, you can go on the elliptical with it. The only like exercise I would say to stay away from is getting it in the pool because you just don't want to get it wet. But yeah, it's very lightweight, you can exercise with it, it's nice and durable. Like I said, if anything does break, which is very minimal, it gets replaced for free, so.
So it offloads it by like how much you tell them to kind of push in or out?
Yes, so when I'm assessing a patient, I take a measurement of their knee when they're weight bearing to see how much valgus or varus they have within their knee. And then I take them seated and extend their knee and kind of create that 3-point pressure system myself and see how much movement I have in that knee to see how much I can offload on them itself. Typically, you're not usually doing more than like 5 or 6 degrees because anything more is a little bit too intense for the patient.
I was going to ask how they tolerate, probably get used to it.
They do get used to it. It's always, you know, an adjustment period too. I mean, when we put them on them, we're going to say only work for about an hour today, then 2 hours the next day, because you'll be really in pain if you wore that all day the first day because it's changing your whole alignment. But they should feel that support right away. And I would say usually about in a week or two, they really start feeling like the benefits of having a brace.
Do you ever evaluate patients and then find that they're beyond that helping or not?
No, I mean,
I have a brother who's very overweight and his knees are so bad. And when I saw that, I thought, oh, that might help him.
Yeah, I mean, there is a weight limit to the knee brace, just because of like with the material and whatnot. But it has been beneficial for patients that are overweight because doctors are constantly telling them, you know, you need to lose weight, you need to work out.
Yes.
But they are in pain because of their knees. So it is beneficial for patients like that to have that brace on there and have the support, and then they can start exercising more to lose weight.
Moving, like just walking.
Yes, exactly. So I believe the weight limit is like 350, 375, somewhere around there. Yeah, and we work very closely with the owner of the company here. He's actually helping us develop something similar to that, but We use it for our prosthetic patients that can attach to their below the knee prosthetics and give them needle allow stability rather than the joint corsets that you might have seen like old school. So they are very creative. If we have an idea, we come to them. They usually can help us work around something. But yeah, it's a really great brace. I haven't really had any issues with it. And it made me like knee braces again. Some knee braces are terrible.
Do you have evaluated anyone whose like situation is too severe? Like their valgus situation is it too much?
I haven't really ran into that issue in regards to the degree is too much for them to, provide support for that. But it's always, you have to have a conversation with that patient too, like, is knee replacement surgery in your future, in the relatively quick future? If it is, it might not be the best option to go with this knee brace because it is custom. So say you have someone and they say, well, in 4 months I'm gonna get a knee replacement. And you're like, okay, well the alignment's not gonna be correct for you then, right? So, but it might be something after surgery we still wanna explore because you do have weakened muscles and whatnot, and the chances of alignment changes could happen as well as after surgery. So that might be something we explore after the fact.
So if they're of a certain age, if they're feeling like, oh, I would really just not like to have surgery.
Yeah.
I mean, probably should have surgery, but I'm 87, so.
Yeah. Right, it's a great alternative. Like I said, it's not a cure to arthritis, but it helps stop the progression of the arthritis, and it helps with support and comfort.
Yeah, we have a lot of folks that, aren't good surgical candidates for one reason or another, a health reason, a current medication they're on, or a different, medical reason that they're having, so.
My sister-in-law fell and she was scheduled to have a knee replacement done in January. She got a blood clot. And she's still dealing with the blood clot.
Sure.
So they can't do her surgery, till they get that taken care of.
Yeah, I mean, we have an employee that, he literally was scheduled for knee replacement surgery, and he got this knee brace, and he canceled knee replacement surgery because it helped him so much. So
Really able to move.
That's what I want.
yeah, definitely take a flyer, take a card, but so it does work.
Is it usually covered to some degree by insurance? And then if something does change, like you're using it and you're losing weight and your tissue changes, like will you have to buy a whole new one? How often does insurance cover one? Like any ideas? Like
Yeah, so I would say typical insurance, so it is covered by insurance typically, and at Hanger, we always run the numbers, prior to hand and like give somebody a cost estimate. It is an estimate, but it's usually a pretty good range in regards to how much it might cost, so they would know in regards to the pricing. Typically, most insurance covers new braces every 5 years. However, if there is a medical justification in regard to needing a new brace, like they lost weight and this isn't properly fitting them, usually insurance will cover it because there's a medical reason why the brace isn't fitting them properly.
I know with the straps, like you can somewhat get it tighter, but after a certain point,
So
it probably won't do what it needs to do, right?
So the straps actually work.
And put them on the right way.
No, you did good. It's a little bit low, but that's it.
Yeah.
The straps actually are adjustable, so you can lengthen and
So
shorten
you can
them.
at least get by a little bit, like,
Yeah. And you can, like the straps and the pads do have like a 6-month warranty to them too, so if something broke after 6 months, they would like replace it. But before 6 months they'll replace it, but after 6 months you can get replacements. It would just be an out-of-pocket cost because insurance doesn't cover that stuff usually, unfortunately. But they keep your scan on file. We have your stuff on file. So they know like what lengths of the straps and whatnot too, but yeah.
Do people have to come like after they have their fitting and receive the brace? Do they check back in one more time, or is it usually like here? It's usually like a one and done.
Yeah, it's usually they come.
People that have prosthetics. Obviously, that's a lot more.
Yeah, usually it's hey, if you have any problems, call us type of thing. If you have any, issues with the brace, they always can come in for, adjustments and whatnot, but it's, we usually don't have to check in or
It's pretty
anything.
straightforward.
Yeah. Any other questions or anything?
Does an orthopedic or orthopedist have to prescribe it for you to get this?
So, it doesn't have to necessarily be an orthopedic doctor,
It
it
could be
could,
your PCP?
it could be your PCP. Now, if you have a the only thing that usually, sometimes insurance likes is having good notes and documentation, in regards to your knee problems, things like laxicity within your knee, or, chronic instability underneath, things like that, having that documented does help with insurance. But going to physical therapy and whatnot too, we can use physical therapy notes as well for that documentation. But it doesn't have to be, orthopedic doctor, it can be, any PCP or things like that.
Can you trial it at all since it's custom?
No, unfortunately, because it is custom, yeah, there is not really a trialing, yeah.
So where do you get it fitted?
So, we have several locations, are they in here? Okay. We have several locations around the area. Any of these places should be able to, provide you with the Evoke.
Can I ask you what the out-of-pocket cost is?
Yeah, so I don't know exactly what the out-of-pocket price is. Because it is custom, it is a very expensive brace. I'm not gonna lie to you. $1,000 or more for the knee brace.
Depending on your insurance.
Yeah, it just also depends on like insurance and things like that too. So,
Right.
You get your life back.
yeah. And it is still cheaper than surgery, so.
Oh, yeah, I'll attest to that.
Yeah. So, still cheaper than surgery, but yeah. I've seen a difference, like I said, with my own family members, with my aunt, in regards to having the knee brace. And I know a lot of times with people with like knee problems, they say a lot of times at night, they're getting like that like after effect of pain and they can't sleep. And that's what she was saying, that was her worst part, was at night she had so much pain because her body was finally resting. And so then it was kicking in all the discomfort. And when she got the knee brace, she was like, I had a full night's sleep for the first time in like 5 years. So.
Did she wear that?
No, so what usually happens with people when they're saying they're having that pain at night when they're sleeping, it's because they're finally in a resting state. So their body starts to get that after ache effect on almost. So because she was wearing it the day and she was getting that support, she's not getting that residual pain at the end of the day. So that's, I hear that all the time when I have patients, and at first when I first started, I'm like, why are they getting the pain at night? And then it was like clicking my head, like, they're finally at rest and their body's not moving, so that's why they're feeling the pain.
And you might have already answered this, except for the people who surgery is imminent, right? It is going to be a reality. Are there any other patients who it's not good for? Like, this isn't going to be the right product?
Maybe a patient that, might have cognitive issues with like putting it on or things like that. Because there is a little bit of an order in regards to the straps that we ask you to put them on. Or, someone that just like isn't gonna be compliant, but pretty much with every type of bracing, that might not be a candidate for a brace.
How long have you had it?
How long has like the company had it?
How long has it been around? Yeah.
Well, it's been around longer than I've been certified, which has been 4 years. So it has to be like 5 or 6 years, I think. Cause I know like before I started working, they came out to the market. So, and it used to be just a hanger exclusive brace, but I think other companies have it now too. So Hanger's been around with it for a while.
And do you find that most people have to stick to a regular wearing schedule, or since it is helpful, like, can they wean down with how often they wear it, or will it just come back? I was wondering, how consistent over
I
time.
always say bracing, especially, except for like, when a brace that requires a wearer for you to walk, obviously they need that all the time, but bracing a lot is like a tool in your toolbox. So if you're just running out to your mailbox and it's just 100 yards away or whatever, and you don't have to throw on the knee brace to just walk down there. But if you're going somewhere like Costco, where you're gonna go work out or things like that, that's when you wanna wear the knee brace. So at first, they might wanna wear it all the time, like all waking hours. But as they get stronger and they're building up support, they might wing down and use it for only higher activities further along. So, yeah. But like if they're going on a plane and they're gonna be on the plane for 6 hours, or they're just watching TV at the end of the day, it's not necessary to have it on because it's working against gravity. So if you're not standing up with gravity, then there's not really a need for it necessarily.
Did you see it, Sarah? You didn't get to.
Oh yeah, can I look at it?
Yes, it's awesome.
These are materials like a plastic or carbon fiber?
Polygrade, aircraft grade, 3D printer.
This is
Sounds
like very
fancy.
light.
Yeah, it is fancy. The only reason why I have that memorized is because I put it in my notes every time. Yeah, but I think the thickness is like 4 to 5 millimeters for the actual plastic itself, they say. Now they'll build it up a little bit more if it's like a heavier patient, but it typical is like 4 to 5 millimeters of thickness.
Nice. And most people seem to tolerate it pretty well, you said,
Mhm.
because it's so lightweight and.
Because it's so lightweight and it being custom,
Saves
I think is the biggest thing. It's just, you know, so many times you get a knee brace and like it'll fit great on the calf, but like on the thigh it's too small or too big, you know?
So annoying.
Yeah, yeah. So having something that's actually custom to your leg and to your shape is, I think, makes a big difference.
And just to be clear, it's good for the offloading of osteoarthritis, but not for like hyperextension. or
We
any
can
other
put
type of things,
It
or-
can help with that hyperextension. We can ask them to put extension
They're
stops.
always see a lot here.
Yeah.
Mm-hmm.
And it does stop at neutral, so, but we can also ask them to put like stops within there so that it gets locked up at a certain point.
That's interesting, then.
Mm-hmm.
It looks more cumbersome than it feels when you look at it. You
Yeah.
don't really pick it up.
Right, yeah, I know that's kind of is like I show patients and they're like, oh my goodness, and then I'm like, just touch it, and they're like, okay, it's not that bad. Because it kind of almost looks like the standard metal ones that you see,
Yes.
but because it's not metal, it is a lot lighter.
That's nice.
It's nice, it's very easy to like set up.
Yeah.
Mm-hmm.
Very cool.
And then, I'm sure you've already said this, but do you use it for anything else like meniscal tear, ligament injury?
Yeah,
anything
there
like
is
that?
set ones for like knee injuries and things like that, that we can provide it. And we are making ones for actually prosthetic patients as well too, for
Oh,
their knee instability as well too. So,
Awesome.
They all kind of look like that though?
Yes.
Generally.
yeah, they all generally look like that. Then there are different colors, so you don't have to get just black.
You can ask them.
Did you not get one of these?
No, that's okay. I think we have some.
Yeah,
So this one is called the Evoke, the one for the tears is called a Provo, but it's very similar in design.
Yeah, they look pretty much the same.
Mhm.
You can even do half and half colors.
You can. I have someone that really liked Halloween and they did orange and black, so they ready for Halloween.
What's the differences like in the braces? Like, do you have separate ones for like medial versus lateral meniscal tears? Is it if you just have a meniscal tear, Provoke is probably better?
Yeah, so like a Provoke for like meniscal tears and things like that are gonna be better because it's gonna be more of like the tracking of your knee is like what it's really supporting.
Mm-hmm.
And then the Evoke is focusing more on that medial and lateral instability and actively offloading the varus or the valgus on a 3-point pressure system.
Oh, cool.
So that's where like the difference is in regards to like what actively they're working towards. you know.
Yes, absolutely.
But you can kind of combine them too as well because sometimes, if someone has an MCL tear, they just have that needle lateral instability, so we might have to offload a little bit too. So that's when it's like, sending it to somebody that, as an orthotist that is like looking at all those factors and what needs to be done for it.
For
So
sure.
if you have a patient that has the brace and they're doing physical therapy,
Mhm.
because you put them in better alignment, can you get better results faster? If they're wondering, can you do, so if they're wearing that in their physical therapy, because they're in better, do you know what I'm saying?
Yeah. If it's
They're
a
not.
Like
they're
they're
better.
asking, yeah.
And
Yeah.
we're doing rehab, and of course, it's at the pace
That's a
Like,
great
can
question. Cause I think it would depend, I think it would depend on the person, and like, people have these compensatory patterns for years
Right.
and years and years,
Yeah.
so it's like, how long it takes each person to break that pattern. But if you're training in proper alignment, I think that would be really beneficial
Yeah,
for anybody.
And what's nice about that is having that knee brace on allows you to focus on other aspects of the body to strengthen as well too. You know, like maybe that's the ankles, maybe that's the hip, things like that, because you're not so worried about the knee in regards to the instability, so you can focus on other things, so that strengthens
And
other body
pain.
pattern. Yeah,
Mhm.
exactly. So, and then I always say, you know, take it to therapy for, so I tell my kids to take it to therapy, but there might be times where your therapist wants you to take it off so you can work on
Yeah,
strengthening the
sure.
knees and things like that, but, it is beneficial for working at other targets and things like that.
At least with that type of brace too, you're still, all the muscles surrounding the knee are still working.
Yeah.
It's not like an AFO or something where it's
Mhm.
stuck in, you know, preventing the muscles from working, but.
Or even like ACL braces, like they're so limiting in what,
Mhm.
like you wanna take those off to work them. Like this, I feel like you could work in.
Yeah, I have patients that run marathons with this on, so, it really is.
There you go.
So there really, as far as I'm aware, there's not much, you know, restriction in regards to physical activity from the knee brace itself.
Mhm. Yeah, that's really cool.
Any other questions or anything about it?
So who does the evaluation then, of what they exactly need to make it ideal for the specific patient?
So they wanna look, depending on your diagnosis, so if you have arthritis, or you have, knee injuries, you know, we have to take that into account, and we really wanna look at all planes of motion in regards to your knee. So front to back, that's the sagittal plane, how much flexion and extension is at your knee, and then, we also wanna look, you know, at the coronal plane, which is on the, facing somebody, side to side of your knee. The transverse plane is probably the third thing that we look at, and that's how much rotation is actually occurring around your knee. That is like a secondary effect from the other two, usually with this knee brace that it can help with. So what we're really just looking at is like how much laxity, and without word means like how much movement
Yeah.
your knee has, and how much offloading you need to produce on that from the knee brace, basically.
But you don't have someone particularly that you would suggest to have that evaluated?
In regards to like a doctor or things like that, I work a lot with Dr. Chris down in Moroville, but his like office is literally attached to my office, so that, and he's an orthopedic doctor, so he's like the first one that comes to my mind. But there's so many doctors around the Pittsburgh area. That's the nice thing about Pittsburgh is you're throw a stone and there's a doctor somewhere around there. So someone that, you know, does specialize in orthopedics, particularly in knees, will probably be the best option for you. But yeah, the first one, if I know someone personally, it's Dr. Victor Chris down in Moroville on Mosside Boulevard.
How do they assess that? Like, what do they do?
So a lot of times they should take an x-ray of the knee, weight bearing, to see, you know, what the alignment is looking like.
Yeah.
And then like an anterior drawer, posterior drawer test for, you know, sagittal plane instability. And then just also, you know, kind of ranging the knee, things like that. Dr. Chris also does like an ultrasound, usually at his appointments, to kind of see if there is any tears within the ligaments and things like that. So that's typically what should be done for like an evaluation. But every doctor kind of has their own process.
Sure.
Do you see most people see an orthopedic first before they see you, or do a lot of people come off the street?
Some people they'll see it online and they'll reach out and like say like, hey, I'm interested in this knee brace, and we can still evaluate them even without a prescription, but we can't move forward with anything unless they're paying out of pocket, which is very expensive, unless we have a prescription. And like I said, sometimes we run into the issue with like insurance, especially like Medicare and things like that, that we need like good physician
So
notes.
it'd be good to probably have like an orthopedic.
Yeah.
You mentioned earlier about wearing one on each leg. That's common too?
Yeah, so I would say probably about like 40% of our patients end up wearing two of them. So
What is the turnaround time?
So from seeing us to the delivery is about 2.5 to 3 weeks.
Not
That's
bad.
pretty good.
Yeah.
Yeah.
Sometimes it's quicker, it's just honestly, the turnaround time is because it's fabricated out in Canada, so
Yeah.
just that turnaround time, but they're pretty good about getting to us on time.
So if someone's interested in it and they make their appointment to the doctor, do they just bring in this information or they say, hey, I've been looking at, I heard about this Evoke brace.
Yeah, so they'll go to the doctors and just need that prescription, and they'll just call whatever office is closer to them and say, like, I have a prescription for a custom Evoke or an Evoke or things like that, a custom knee brace, and then come.
Yeah,
Yeah.
I mean, you can take that in to make, you know,
They're pretty good about,
but they don't all know what an Evoke knee brace is, you
Yeah.
know, that's certainly something we would love, but,
Yeah.
we're not quite there yet.
Oh,
But,
okay.
so if you took that with you, you know, that might help them
Yeah.
understand
Okay.
in case they haven't
does
seen
it
it
have to
before.
say Evoke or just a knee brace?
It doesn't have to say
It
Evoke.
doesn't have to say Evoke, but if it says custom knee brace,
Custom.
custom,
Mhm.
because insurance sometimes will look at that script and they say, oh, it says knee brace, so you can just get the one that's like from CVS,
Yeah.
like, you know what I mean,
The more
so.
specific, the better.
Yeah.
On all regards.
Yeah, it will just eliminate a lot of headaches down the line
Yeah.
and make the doctors less grumpy, because then we're calling them and saying, we need to change this, so.
Yeah.
But if it says custom, that like eliminates a lot of the headache in regards to it, so.
Very cool.
Who is most likely to register for these, like, in your experience so far with doctors? Like, where are people going to say,
I would say either
can
or.
they even go through their physical therapist and say, hey?
So
you
usually physical therapists will have to refer to the doctor, yeah.
Yeah.
No, I know you can't register for it, but because you're in communication with the
We could
doctors.
maybe recommend a
Yeah.
doctor, but
um,
like you said, one in Monroeville seems like he works a lot.
Yeah, so orthopedic doctors or physical medicine and rehab doctors are also good.
So if the doctors, orthos aren't really aware of it, do you think any of them would balk if they were to prescription? I mean, have you heard anything?
I personally haven't run into any issues. Now there are, of course, always times in regards to like a doctor is not aware of it, and then that's just us having to have a conversation with them and explaining, you know, this is the benefits of why we want to do a custom knee brace versus an off-the-shelf one, and explain to them what the benefits are and what the brace is actively doing. So usually if we have a conversation with the doctor, they're more receptive about writing that prescription, so knock on wood, I haven't really had that many issues with it, luckily. But again, I am kind of spoiled because I have Dr. Chris down the hall for me, so he's primarily who I deal with, so. But yeah, physical medicine and rehab, orthopedic doctors probably are gonna be your best shot with these type of knee braces.
Any other questions or anything?
Is that is he at the south side or Monroeville?
The Moss Side Boulevard
Yeah.
location.
He's literally like, it's the same address,
Okay,
so,
just if anyone asks.
yeah. Yeah, and then he'll probably just say, okay, take this script down the hall, and then they'll walk down the hall to us, so, but yeah.
That's fine.
Yeah, and he is a very good doctor. He looks at like kind of everything too. You know, if you come in for a knee problem, he's not gonna look at just your knees, he's gonna look at your ankles too and your hips and kind of take an assessment of
Like
that
the
as
whole
well.
picture.
What's
Yeah.
his name again?
Dr. Victor Prisk, Prisk.
Yay. Well, I think this is just a great alternative for some folks out there. I mean, I know you guys, and Barb, you even just had surgery, but I know with your history too, like, I just feel like more options you have,
Mm-hmm.
the better out there, you know?
Mm-hmm. And surgery is like such a long recovery too.
Yeah.
You know, like, so if like you have to caretake for someone or like, and you just don't have the option of being down for the count for 6 months,
Right.
you know, it's nice to have another option.
Yeah, and it is nice, yeah, exactly, like the nice thing about a brace is if it doesn't work, you take it off, right? Surgery is a very permanent thing that we have to, you have to account for, and of course, like I said, there are times that the surgery is the option. But this is a nice step in between, rather having to go to that one end of the spectrum. Or maybe it's something that you go back to if you're not having, surgery's not always 100% successful. So it might be something that you need after the fact too. So it does happen.
Definitely.
Thank you guys.
Yeah, thank you for your time, you guys were great, engaging audience.
It's a very hot topic for our group.
Well, yeah, we see often.
Yeah.
Right?
Mhm.
Our age group.
Do you think there'll be other ones for other, like hips, ankles? They're a lot harder because obviously.
Yeah.
there's no
Hips
motion,
might
but-
be hard, I think.
Yeah, it would have to be pretty cumbersome.
Yeah,
I just
we
didn't
are
know.
using, they're not really custom, I mean, there are custom ones, I've made custom ones, but, we do have like a little bit lower profile, like knee brace or hip braces too, like for like hip abduction and things
Right.
like that. So there always are new things coming out. The nice thing about technology is there's all kinds of things coming along with it. I would say, as far as like prosthetics and orthotics has always been prosthetics has always been kind of like on the front line of like new innovations. But orthotics is slowly starting to catch up. So there are new things. There's other custom knee braces other than the Evoke. So you might come in thinking you need an Evoke, and I might say, hey, there's another knee brace that actually is going to work better for you. So keeping an open mind, and that's something that like we're always trying to learn here at Hanger is like new options for our patients and having that discussion too with them. And but yeah, I mean, there's like a KFO that's electronic KFO nowadays that is actually like kind of helping move for the patients rather than just the old style metal. So there are new things coming up. Who knows? We'll have.
Yeah, nice.
Custom, that's the key.
Yeah, custom.
Yeah.
Okay.
I feel like a lot of times it is like, oh, I need a knee brace, I'll just go and get one off Amazon
Yeah.
or something. I don't think a lot of people know they can go to an orthotist and
Yeah.
also do
Yeah.
this type of stuff.
And sometimes the CVS knee brace is also
It's good,
neat.
yeah.
Gets them going, but sometimes we need to look at more planes of motion and really address that.
For sure. Any other questions for the ladies?
Very interesting, though. Thank you.
Well, thank you guys for coming.